Hi everyone, my name is Damilare Adegboye, the Damilare Adegboye on all socials. Welcome back to Unfiltered Christian Conversation. And today is going to be a little bit different. Yes, we're starting a series on mental health, dealing with the Christian faith. Oftentimes, especially in church after service, when you ask people, how are you doing? Everybody just say, I'm fine, and all that. But truth is, you don't know who is truly fine and who is not. And those little conversations that we have in church oftentimes don't get the entirety of what everything looks like, right? So we're going to be touching so many things, few things concerning how exactly do you deal with depression, right? Subsequently, you get to learn a whole lot. What are the medical symptoms? What do you need to know? What do you need to watch out for? How do you deal with it? Who do you talk to? Questions and questions in your heart. This is really going to bless you. I'm sure this will bless you. And today I have with me a professional.
Hi everyone, I am Olukemi Mary at Kintayo. I'm a mental health nurse and I'm a psychiatric nurse specialist. I'm so glad to be here. It is a great opportunity that we have today.
So good to have you. Where do we begin? Because this is really wide. Let's have it first from a medical perspective. How do you describe depression?
Hmm. Depression is a wide topic.
Exactly, exactly. Something very wide.
All right, so we will define depression now, all right, according to World Health Organization. Depression is a mental disorder that is characterized by persistent reduction in mood, depressed mood. So the key word there is persistent. So we can see people that, oh, this person is sad. Meanwhile, the person is not depressed. So the key word is persistent depressed mood. And when this person is not ready, is no longer interested in activities, we can see that, oh, this person is depressed. Does that
So,
answer your question?
yeah, yeah, So you're saying that something like depression is not the same thing as just being sad, but you can be depressed and still be sad.
Yes, you can be at the same time, but
But,
it's
but
possible
chance, you're
that,
also saying that chances are that a person can be sad, but they are not depressed.
yes, let me give you an
What?
example.
Okay, okay,
All right. So we have an individual that just failed an exam.
okay,
You sat for a professional exam,
okay.
and eventually, when they release the results, it's not favorable,
Yeah,
especially if you have an extra A and everybody is seeing you withdrawing from people. You're
okay.
not like the way you used to be. So people can easily say that, ah, that person is depressed. Meanwhile, the person is sad.
Just sad.
All right. So we can easily differentiate the two. How? We could say that um, sadness is a weather, and we can say that depression is the climate.
Mhm.
Now, what is the difference? One settles in, one is passing by.
Okay, okay.
So the rainy season will soon be over now. Right. So that
Yeah.
is how sadness is. There is a key factor. There is something that is causing it there. There is a temporary cause, like a temporary cause, something has caused it, and that could be a major difference between the two.
But the kind of example that you gave, can it also lead to depression with time?
Yes, if those issues are not addressed with time. So when those issues are prolonged, when you see somebody, let me give an example of an individual I met some times ago that had issues with the partner. They were in a relationship, and over time, they could not settle scores. All right. So she was there, she was feeling grieved. Meanwhile, they never addressed the issue. So there was a prolonged issue. Meanwhile, she kept on holding back from people. She never spoke about it. She never spoke to a therapist about it. So it aggravated. So the weather, like it got prolonged. There was persistency in those symptoms. So that was how she dived into depression.
So, with time, it can always lead to.
It can if it's not addressed properly and in time.
No, I think for believers now, because we're Christians, because we're believers, followers of Christ, it's often thought that, I mean, there's this thinking that people just have that you cannot be depressed. And yeah, I know that, even pastor would teach it a lot that there's the joy of the Holy Ghost. And how do I say this best? That maybe, we had a series recently where we were talking about depression in church. And it makes sense because it means that we see people beyond what church should just look like. We're not just telling them that you should be happy, and when they look at just saying that, come on, you have the joy of the Holy Ghost. That sometimes we can take our time to really address what's going on in people's mind, to ask questions. So I think for believers, we should not just see it as though, oh, because you're a Christian, you cannot be sad. You just have to be happy. I've seen people use words, and I know subsequently will touch things like that. They just say, be fine.
Oh,
You see
you'll be
someone just
fine. It is
sitting,
well.
it is well. Or
Ah,
especially when it has to do with the male gender, that's you're a man,
man up.
man of, come on, you're a man. So imagine that you're a man and you're a Christian. Come on, you have the joy of the Holy Ghost in you.
Mm.
How do you address things like that?
All right, you're very correct. It's a misconception. Some
Okay.
people say that because you're a Christian, because you're a born again believer,
Yeah,
you cannot be depressed.
it's not expected
Right?
of us.
It is not. So there's a part I would like to stress that there are risk factors to depression. So
Uh-huh.
we cannot just wake up in a day and say that this person is depressed. So there are things that can be a predisposing factor or a precipitating factor. Right. So I would mention a few.
Okay.
We have the biochemical factor.
Okay.
No, I'm not going to bore you with medical jargons, I promise. We have the biochemical factor. There could be an individual with, for example, we have about three hormones that are very functional in this field. We have the serotonin, we have the dopamine, the norepinephrine. All right. So it could be that one out of these biochemicals are on the low level, and that is where the influence of a professional is needed. Sometimes pastor was saying that the report of a doctor is not a negative
Yeah,
report,
it's not a negative report.
right? So we would need an assessment. So that could be a risk factor. Then another could be genetic. In a family where there is a twin and one of the twin has depression or came down with depression, there is 70% that the other twin, is
Yeah.
going to come down very soon.
Mm.
Yes, there's a chance for that. And then there's that environmental factor. I'm trying to stress this point so that we will know that the fact that we are believers does not mean that we are not exposed.
It doesn't stop those things from
It
happening.
does not stop those things from happening. So the environmental factors could be stress, it could be, violence, yes, it could be disappointment, all of those things could gather together and cause these things. Rather, instead of us thinking that Christians cannot come down with depression, rather we would find how to avoid it or treat it.
Hmm.
Did I answer that question?
Yeah, that makes sense.
Okay.
You mentioned violence. I'm thinking something that could it be possible that people can actually be violent because they are depressed? I don't think naturally it looks like something that could be linked, but I just have it somewhere in me that people can actually start behaving erratic, can behave in a way that does not look normal, but it's just because they're trying to deal with something within. So we're not addressing matters that should be addressed psychologically or mentally and take it casual.
All right. So I'm going to answer that question based on a general mental health overview. There's something we call projection
Okay.
in psychiatry. Somebody is going through a stuff,
Yeah.
like an individual has an issue, probably at home, and then gets to the workplace and then is yelling at everybody or
Hmm.
is being out of place,
Yeah.
probably in church or at the place of work. It could be that there is an underlying issue. We call it underlying issue. There's something that is causing the person to misbehave, and if it is not addressed, the person will continually be a nuisance. So that could be an issue
It
too,
could be. Now, speaking of church again, church is a place where faith is being taught,
right?
joy and yeah, joy and the things of God are being expressed, which
Right.
means that more chances are that in church people are always smiling. A larger percent of people. Can people be smiling and still be depressed?
Yes, I'm loud on that. Yes. In fact, I was telling someone recently that, I'm very cautious with people that are always out there. I'm very cautious about people that are always laughing, people that are always there, showing up for people. And what they're always the one checking up on you, right? I'm always on the guard that something is wrong
Are you
somewhere.
fine? Are you
Yes,
okay?
yes. So there's something we could associate it with. It's possible that people now there's a misconception. People think that when you are depressed, you must look sad. It's not true.
So I don't have to entirely
It's not
look sad.
true.
I can be all smiling on.
Yes, it's
I think
possible
especially with the male gender, it happens a whole
because
lot.
they're trying to man up.
Is it not what community has done?
Hey, because they're trying to man up.
It's community.
You know, research has said that the larger percentage of women, that try to commit suicide is high. Meanwhile, men who try it are more successful. Why? Because men would not talk. Men will not seek for help.
But women will.
But women,
Most
when they are
likely
trying, they would have sent you message that
say things like,
it is
I don't
about to
even know
end.
what's going on, and what if you don't see me tomorrow?
So things like that. So it gives an impression that this person is trying something, and help could come around the individual. But the men would not say anything. Sometimes they come around you for a while, just spend time with the family, and then the next morning they are gone.
Growing up, I know that this happens a lot in a lot of families where the father is just outside in the evening, just trying to think of a couple of things. I think in a way those things it does not entirely have to be depression, but it means that there are things going on in their mind that they
Mhm.
cannot or they are not able to share with people. Now, especially speaking of the kind of country that we have, this is Nigeria, where it is mostly seen as if you are a man, you can't really talk about what you're going through, the emotions, you have to man it up. You can't really be seen crying, and ladies do that a lot. Do you think it is something that can change in any time soon?
Yes, if we as a generation can come to understand that this is culture, that perspective is culturally accepted, especially in the
This part of
this part of the country.
this part
They
of the
believe
world,
that
then this
you
part
know
of the country.
they believe that because you are the head of the family, they believe that men are the head, so
Ọkùnrin ni
you
ẹ́, kí
should
ló tó ń
man
ké?
up,
Hey
right?
man, come on.
So you are the man of the family. I mean, you are the head of the family. You are not the head of everywhere.
Yeah,
There was a particular man of God that was saying it that you are the head of your family. You are not the head in
yeah.
everywhere. So it is possible that men seek help, and it is something that there are several organizations coming up now to train the boy child. I love it so much when I see people with that initiative. I know somebody that is actively into that, trying to build teenage boys to instill the correct perspective of life
Of
into
what
them.
life should look like for them.
You don't have to be stabbed at the back and begin and smile outside. You need to talk, to have conversations to
Yeah.
right.
I think men really should probably learn more how to communicate, to speak out. But
Mm-hmm.
and one of those things is also that people in a relationship, if they find it a little bit difficult, and again, this is culture, where culture society has it that as a man you can't really talk about things. But we also have to consider the fact that now you might be okay with it, a man coming to you to tell you that, oh, I'm not feeling too good, I'm not fine, and all this. You might be fine with it, but there are several, I don't know if there's statistics for something like that. I believe that a lot of ladies might not exactly see it as something fine to do. As a man, if you're coming to say that, oh, I'm not good, I'm not fine, and you're trying to rant or
They
say
feel that it's
something,
less of you.
it's less
They
of you
make
to do
them
that kind of,
feel less of
yeah. So
themselves.
with things like that, I think that kind of man, that kind of guy would not want to actively, want to say his mind. They just want to, stay back, hold back, and deal with whatever they are dealing with.
And that's why I stress that fact that it is culture. We need cultural shifts. We are going to make progress in that aspect at all. Both the ladies, both the female and the male needs to come into the understanding of these things, that speaking up as is not gender bias. It does not have to be
Yeah,
that because
yeah.
you are a lady, then you must always be the
Whether
one
you're
to
male or
speak
female,
up.
we all have emotions.
So please, it is very important that we learn that.
Who is more at risk
to depression.
to depression?
The ladies.
Why? I think I might want to say it's the guys, the male gender, and
You're
I'll tell you
supporting
why.
the guys.
No, no, I'm not supporting the guys. I'll tell you why. That's why I said I'll tell you why. Why is because you mentioned something that for the ladies, oftentimes when they are going through something, they would definitely talk to one or two persons.
Yeah.
But for the guys, they're just keeping it. It's just there. And you can just wake up and realize this guy is gone. Do you know people have normal, they have disease, they have cancer, they have things, physical things that could just have been addressed to you
Mm.
get, and because they're not saying anything about it, they die. But for ladies, they would one way or the other have told someone, "Oh, I'm not feeling too well. I don't even know how my day is going, this and that and all that." That's my own reason why I think I want to see the male are more at risk. So let me hear your side.
All right. Thank you very much for that. Now, research has shown that the female, the ladies, or the women, or the girls, right, are more prone to biochemical disturbances. What do I mean? Ladies are more prone. I'm not saying that the guys do not, fall into the pit of depression,
Yeah,
but ladies are more prone to that because of so many factors. When I was talking the other time, I mentioned about two risk factors. I said there's the biochemical factor, there's the environmental factor, and what of the genetic factor, right? So ladies are more on the receiving end in the society. Yes, and I would stress that using the environmental factor. Okay, so sometimes ladies are on the receiving end when issues happen. The ladies are the ones, trying to figure out things. I know you are disagreeing with me currently, but ladies are the ones trying to figure out how those things are. They are more emotional. Why? Sometimes their biochemical makeup is prone to being disrupted. Yes, the ladies have hormones running through her body, monthly flow and all of sometimes when there's a particular phase in the menstrual cycle of a woman that her mood becomes very low.
yeah.
Yes, I'm grateful
Why
that
am I saying
you know
yeah?
that. I'm grateful that you know that. So all of those factors could come together and cause a an issue. But men, like you said, also are prone to falling into this pit of depression. Most of them would not talk, most of them would not address issues, most of them would not seek for professional help, right? So
Yeah.
we could also say that men have high percentage or high risk of falling into the pit of depression.
Okay. I think I agree with you. You said statistics has something to say about that, but really, this is Nigeria. I mean, what do you think about people seeing therapists?
Okay.
Now, this is Nigeria again. We always have to put that into consideration. And this is a country where we don't really have much of that here. That's one. Two, people do not exactly believe that much. Again, because of culture,
Mm.
right? Again, because of culture. To say, oh, why are you seeing a therapist? I have a therapist joke. Let me say it. It's a dry joke. Have you heard it? Have you heard it before?
No.
No. Okay, let me tell you. I say that I think that those that see therapists, right? You're paying a therapist to hear you out, one, and to judge you, two.
Mm.
You could just get married and have all of that sorted.
So the partner will become the therapist.
It's not the same thing that happened in
It's not
relationships,
though.
but
Professional help. Professional.
that's why he's a therapist outside to let them know you about this. What do you think about seeing a therapist? And
Now, thank God you mentioned this part of the world
yeah,
where culture has filled everywhere. Sometimes you're not careful, culture is leading your spiritual life. Okay, people believe that it's a waste of money. Some people, I know someone
and
that
I think
believes
some
that.
believers will also think probably it's lack of faith.
I know someone that says that it's a waste of time,
Hmm.
right? Now, I also know pastors that invest in these things. In fact, they send their members, their very active members, on therapy coaches.
Mm,
They want them to learn these things, right? So my perspective or my belief about this is such that believers need to learn that talking is a therapy,
mm,
right? And I remember when the scripture was talking in Romans chapter 12, how that is important that we renew the mind.
yeah.
Okay, so it is very important that now talking in the perspective of the scripture now is very important that we learn these things when we now leaving professional aside. Now when we come together as a family in the church, we study the scripture together, we discuss about the scripture. During the time of discussion, people will have questions to say, people will have things on their mind that will come out, right? That they will share as a family. That's where the aspect of bonding as a church comes into play, right? So therapy, it is not what we think it is. Some people just believe that, oh, the therapists you are going to meet safe, they have their own issues. They are just collecting your money, right? But it is far more than that.
I think I want to say something that if we look at it so much, the third side, I think church is also something like that.
A therapy center.
Something like that sometimes. Because you're in church and sometimes your faith is low, you're not really happy about something, and pastor just says something. Sometimes it's not even what is being said, it's just seeing other believers.
Yes, that reminds me. There is an aspect in my section that we call spiritual therapy.
Okay.
So we do a lot of therapies. We do, cognitive behavioral therapy. We do a lot of therapy. But there's this aspect we name spiritual therapy. So whatever religion you associate with, your therapist will come and see you. With whether you're the other side or you're on this side, your therapist will come see you for that 1 hour or 1 hour 30 minutes, and they're
Okay.
going to talk about the faith. They're going
Mm.
to ask questions. They're going to relate what God is saying about your life to you. They're going to study the Bible together. They're going to be giving memory verses, assignments, those things. So it is very important that we understand that therapy is not the way we see it. It is talking, relating, discussing the Bible, sharing life experiences, and what have you.
I think it could also be more like you are really talking about what exactly is wrong with you.
Exactly.
It's more like just having someone to talk to. But now you are just putting much of the attention on what exactly is going on is wrong
Yeah.
with. No, subsequently we'll be touching so much of these angles. We'll be touching so many angles. We'll be able to look at what are the causes, right? What are the
Mm-hmm.
things that can also come out from
The
having
types.
things, talk about. I know there's a place for trauma in matters like this. There's a place of pain. There's also the place of hurt. There's also the place of having. Is it possible that there's a place of having, physical, causing physical? What's this thing called?
Self-inflicting injury.
Do you
Yes,
get things
yes,
like
very
that?
possible. Very, very possible. When you see an individual that is depressed, one of the physical signs that you'll see, aside from withdrawing from people, most times they inflict themselves. It's called self-inflicted injury,
Mm.
psychiatry. They just stay alone in their room and then they are cutting their body. It gives them a soul relief, which is, of course, very negative. It gives them a soul relief. It makes their soul feel better negatively. Yeah, before they start having suicidal ideations and then eventually.
What are the simplest, most signs that we probably need to watch out for? And I'm saying this for we have people around us, of course, and people would say that, especially if you're in Nigeria, if you're born here, life is leading you 1-0. In a way, chances are that you're not entirely happy. Everything is not exactly going well. It's always done with school. You don't have a job, and there are bills to pay, right? Not let's not even go as far as feeding, as little as feeding, those minor things, and then of course it happens every day. So what are the most simplest signs that looks I mean something that we'll probably not think about, but they can actually be signs.
All right, so I'm going to mention a few,
Yeah,
and I believe in subsequent
yeah,
series
we'll
we
be
are
able
going to
to
have to
break
talk
them down
better
more.
about that. You see, inability to concentrate. When you see an individual that is having difficulty with concentrating, their line of thought is distracted, their stream of thought, they cannot concentrate, they cannot attend to a simple instruction, right?
Exactly.
So yes, it's one of, remember when I was defining, I said we cannot make a clinical diagnosis until about five symptoms are present for at least 2 weeks. So
Hmm.
because I said lack of concentration now does not mean that
I'm just
as I'm
thinking,
talking to
oh, I
you
don't,
now,
I'm not, because I know that people will start judging themselves that
uh
way to say that, okay, okay, yeah, makes
so
sense.
inability of that individual to concentrate on a particular matter could be a factor. Then number two, we have individuals with poor sleep pattern
Hmm.
or excessive sleep pattern.
No, I was saying something the other time. I'm going to say it again that,
Okay.
so are you saying also that if you're not sleeping enough, I could be depressed because it could just mean that I am depressed. I never have enough sleep.
No, you are not
Okay.
sleeping enough because you have a work that you are attending to.
Okay, yeah, that makes sense.
Hmm?
I'm working, I'm doing
You're working.
something.
You are being you are productive. Okay. So that could be stealing your time and then you're gonna make up for it. Right?
It's likely or not. Well,
So these people are either not having inadequate sleep or having excessive sleep. Out of 24 hours, someone is sleeping for 18 hours.
it could be something to watch out for.
It's a major factor. It means the person does not want to have contact with reality. They are shutting people out.
I think you mentioned something earlier that nothing less than five of those symptoms, right,
Yes. Together.
consistently. So that means you're not just saying, oh, I'm only sleeping 18
No,
hours.
no,
I'm
no,
only.
no, 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 no. So those things have to be together at least for 2 weeks. So we cannot just diagnose someone in 2 days that she hasn't been talking to anybody in 2 days. So this person is depressed. No, no.
We'll close with these two questions. How do you think you can really talk to people? I mean, walk up to people that you feel that you're seeing few signs. To talk to someone that you think might be going through something like that.
Or
You
in
just
a
see
church
someone,
environment.
especially in a church environment, and we also have to consider the fact that mostly for church people, people don't, not everybody have come to that place where they think you can just open up to anybody in church.
Yes, people
Yeah,
are on their A game. They
yeah,
are very protective
yeah.
because
It's
of
church and
past experience,
just
church
a
hurt and all of
member,
that.
yeah, also because of church. There's a place of that. I think one of the sections we really have to talk about church. I've had a lot of experiences. I've heard people's stories. And it's one of the reasons why people also tend to, at a point, they hate God. They don't just withdraw from people who dear Lord. They begin to withdraw from God Himself. Do you get? Because they
Yes,
feel that we are God's people and we are doing this kind of evil to ourselves, then maybe God is not worth following for this.
exactly. You know, I
The
had
question
someone
is crazy.
tell me that God does not love me, he made my mom die.
Mm-hmm.
Automatic depression. It was literally someone in the hospitalized already. Said if God was truly God, he could have prevented these things from happening.
From
He could have
happening.
prevented these things from happening. And he broke down.
Hmm.
All right. So when it comes to cases where you are seeing signals that this person, there's something about this person that we need to figure out. It is very important that you approach the person non-judgmental.
Yeah, that's very important. You don't come off at.
You're not the Lord and the person's personal savior.
Let me give you an example. You are depressed. You are a believer. You are depressed. You don't even have faith. Is this the best you can do?
Right? Did you hear that? Did you hear that? So there's no need for that. It's
I mean, it
very
can be in the same context, but there's a better way to say it.
there's a better approach to these things. You could approach the person and simply give an helping hand. I noticed that you've not been available for a
For
while.
a
Is everything
while.
okay? I noticed that you've not been sleeping well. I noticed that you're having dark circles. Are you eating well? Do you need me to get you something to eat? People express their mind when they are comfortable.
Yeah. So that means that you're not just coming at first and the thing you want to talk
No,
about is, oh,
people are very expressive when they are comfortable. There's something we call ability to gain trust.
yeah,
Once you be able to gain trust with an individual, there's nothing that person will not
you
tell
will
you.
not tell me.
There's nothing that person will not tell you.
I think if this is a skill, every believer should have it
We should
because we're a
learn it.
family. We should learn it. my family, and that means that like a body, right? One part will not do well without the other part. You can say, "Oh,
Exactly.
I'm leaving this for the leaders of the church." Am I the HOD? Why is she not in church? I saw her. She's fine. I saw her this morning while I was coming to church. I remember way back in the days when I was in much in my old church. You see someone, you're going to the same church, but you see them worship clothes on the morning. You're just like, "Oh, they'll be fine. I'm just going." It looks like something casual, but it could be that something else is wrong and
Yeah,
things like
yeah. So I would like to say that before we close,
that.
that
Yeah,
reach out to someone. Always check up. I have an habit when somebody's name flashes through my heart.
you want to check
Two
up.
things. Is either I pray for the person or I reach out immediately. Please learn to reach out to people. Learn to pray for people.
Mm,
Learn to check up on people.
yeah,
Very, very important.
it's fair. I'm thinking something. Can depression be faked?
Oh, an individual is faking depression, like
Trying to not look good,
to gain attention.
to gain attention, it could
Ah,
be.
okay, right. So, but we will not call that depression.
Yeah, well.
We will not call that depression. We'll just say that the person is an attention seeker. Person is all out there trying to get people's attention for one or two reasons that is best known to them.
Hmm. One more. Let me ask this, and then we'll give it a wrap and begin to talk on how subsequently things to expect. Is it possible that a person is fine? They don't have money issues. They don't have health issues. They don't have communication issues. Let's say they're dating. They're in a very good relationship, and yet they are depressed.
Yes, that's major reason why I made mention of those risk factors. It could be genetic, it could be biochemical issue, it could be that from birth there's a reduction in the level of dopamine in the
Wait, so
brain.
you are saying it's possible that something happens medically in their body that they
Yes,
are not exactly the cause,
yes.
and can it be addressed by them? Can it do something about it?
We have to place them on most times antidepressants. We have a number of medications that we
So there are
place.
medications for these
Yes,
things too.
we have selective serotonin reuptake inhibitors, SSRI. There are medications. We have the monoamine, oxidase inhibitors. We have medications that we can place
I
on
think
them.
this is more reason why, especially as believers, we cannot entirely put the whole issues of depression to faith to
It
saying
has
that,
become a
oh, you're
stigma.
just, yeah, you're not fine, just pray, you'll be fine.
Oh no.
Just have faith, to go and study. I mean, there's a place for all of those things, but we
Right.
cannot entirely put 100% of everything that is going on with a person's life.
Proper
Some ways
assessment
a
has to be
proper
done.
assessment
Proper
has to be
assessment.
done. Has to be.
Sometimes it can be demonic.
Mhm.
Yes, it can be demonic. There's someone that is absolutely fine. There is nothing wrong with them. There is nothing wrong with the biochemicals. It's just the spirit of heaviness. It's just a demon that is jumping on their shoulder. Those things have to be addressed spiritually.
So this is really good that we're having this conversation, and I think it's really going to help a lot of people out there to tell you that depression is more than what you think it is. I mean, I'm hearing new things to hear that there are people that they can actually be depressed not because they chose to, right? But because there's a medical condition, something going on in their body they are probably not even aware of. You really need to join the rest of this conversation as we continue to hear things. I mean, open up your mind, see how you can look at these things for yourself, and to be able to watch for your partners. I mean, the people you have around you, people you have in your environment. And I really believe in a way that if depression is well dealt with, I think together as a community we can have a better life
Yes, we
because
have
more
less
people,
less suicide risk.
yeah,
Yeah, and when we have a family that can bond.
yeah. I mean, there's so many stories of families that I've seen people say things like, um, when I marry, I don't want my in-laws come. These things are coming from somewhere. They are coming from somewhere, definitely. So it's really good we're having this conversation. What do you want to say to my audience as we wrap this up?
You said something the other time, and I'm going to repeat it. That it's very important that we learn how to check up on people.
Yeah.
It's important that we learn how to pray for people. We would learn how to look out for people. All right. So this is If you are in a family of God and you're noticing somebody acting in a particular way, very important that if you're not a professional, reach out to somebody that
That
can
can address
address that
that.
issue.
Yeah.
Right. So I would like to see you in the next series because we have a whole lot to
There's a
talk
whole lot to
about.
touch. And don't stop praying for people. Like she said, don't stop praying for people. Don't stop checking up on people. Sometimes you don't have to talk about details. Like she said, building, there's a place of building bond, building trust where you're just saying hi to people at first, right?
Exactly.
It's possible that you're just, oh, hi, how are you? How are you doing? They do it again, again, and again until one of those days the person just will say, oh, do you know this is how my day went? I mean, it does not have to be something way more extra. We'll see you again in the next episode. Again, I'm Damla Radeboy, and together with me is.
Olukemi Mary.
All right. Thank you, everyone. Bye.